Welcome to this explainer. It's so easy to look at a managed care provider and just see a giant calculator, right? Just tallying up monthly premiums and subtracting payouts. But the truth is actually far more complex and, honestly, vastly more interesting. So today, we're going to pull back the curtain and look at the hidden engine of the managed care industry. We're exploring how managing patient outcomes and quality of care isn't just some medical imperative, it is literally the bedrock of financial valuation. Okay, let's dive into this. Put yourself in the shoes of an institutional investor for a second. When you're looking at enterprise value, you really have to ask a fundamental question. Does a healthier patient actually mean a healthier bottom line? Now, historically, some might have argued that managed care is just a numbers game of risk pooling, but modern sustainability accounting tells a completely different story. As we'll see, managing responsiveness, improving patient health outcomes, and delivering high-quality care actively protects enterprise value. It drives increased market share and even directly influences the reimbursement rates these companies receive.
Here's our quick roadmap for today. We'll be hitting the value of better care, unpacking plan performance, tracking retention and grievances, focusing on improved outcomes, proactive wellness programs, and finally, protecting enterprise value.
All right, jumping right into Section 1, the value of better care.
So how do we actually establish objective, hard metrics for something that feels as, qualitative as care? To do this, we rely on the SASB accounting standards for the managed care sector. These standards provide a really rigorous framework to measure sustainability risks. And let's be clear, this isn't about PR, it's about financial reality. The SASB framework shows us precisely how care quality dictates market share and reimbursement rates. By tracking specific data points, investors can see exactly which companies are building a sustainable business model through superior care and which ones are risking their entire future just to cut a few corners.
Moving right along to Section 2, unpacking plan performance. The very first critical metric we've got to look at here is the enrollee retention rate. It's exactly what it sounds like, but the math behind it is highly specific. This rate essentially tells us if customers are actually satisfied enough to stay with their plan type year over year. A high retention rate implies that a managed care entity is managing its performance in areas like responsiveness and customer service well enough to maintain real competitiveness. In an industry where acquiring a new customer is frankly incredibly expensive, keeping the ones you already have is the first line of defense for enterprise value.
Now, what's actually really fascinating here is the nuance in the calculation. The standard specifically separates involuntary terminations from voluntary attrition. For example, if a company kicks someone off a plan because of fraud or intentional misrepresentation, that doesn't hurt their retention scores. It's totally excluded from the calculation. However, voluntary turnover, when an enrollee actively chooses to pack up and leave for a competitor, that absolutely acts as a glaring check engine light for investors. It strongly signals a failure in plan performance.
Which brings us to Section 3, tracking retention and grievances.
Okay, this brings us to a super interesting metric, the percentage of reversed claims. This measures the claims that a provider initially denied, either at pre-authorization or at the time of payment, but then the customer appealed and the company ultimately reversed its decision, basically admitting the denial was invalid. A high percentage here, that is a massive red flag. Excluding simple billing errors, a high rate of reversed claims signals deep administrative inefficiency and severe customer friction. Think about it. It means the company is spending money to deny a claim, frustrating the patient, and then spending more money to review and ultimately pay that exact same claim anyway.
Furthermore, we have to look closely at the plan enrollee grievance rate. A grievance is any formal complaint expressing dissatisfaction with how healthcare services are provided. And this covers a lot of ground. Was the service timely? Was the procedure appropriate? Could the patient actually access the care setting? Did the treatment fail to meet accepted standards? This grievance rate is calculated per 10,000 member months, which is basically standardizing the math across different sized patient populations. It gives us a really stark mathematical view of patient dissatisfaction. When responsiveness drops and grievances rise, a managed care provider's reputation takes a serious hit, directly threatening their market share.
All right, let's shift gears a bit. Section 4, focusing on improved outcomes. So, managed care entities can play a totally critical role in maintaining and improving the physical health of their enrollees. Providers tackle this through two distinct avenues. The first is primary prevention. This focuses on stopping illness before it even starts by promoting healthy behaviors. Think immunizations, exercise programs, and maintaining a healthy body mass index. The second is secondary prevention, which is all about early-stage disease detection and management. Catching a chronic condition early is vastly less expensive to treat than dealing with a severe, late-stage emergency.
Which naturally leads us to Section 5, Proactive Wellness Programs.
To actually execute these primary and secondary prevention strategies, standards require companies to relentlessly track specific categories of wellness programs. We're talking diet, nutrition, exercise, stress management, mental health, and smoking or alcohol cessation. By tracking the percentage of enrollees actively participating in these distinct program types, investors can reveal exactly how proactively a company is managing its risk pool. Because here's the thing. A population actively engaged in these programs is fundamentally cheaper to insure over the long run, and it builds the provider's reputation for delivering top-tier care.
But, we absolutely have to contrast those positive outcomes with the flip side, the severe penalties of poor care. What happens when a provider fails to deliver high-quality outcomes? Well, it directly damages the bottom line. According to the SASB framework, the true costs of failure include decreased market share, heavy regulatory fines, program suspensions, and naturally, increased legal costs. Failing to invest in the health of your enrollees isn't just bad medicine, guys. It is a profound financial liability that destroys enterprise value.
All right, the final piece of the puzzle, Section 6, Protecting Enterprise Value. So how does all of this qualitative data translate into hard quantitative valuation? It basically operates as this distinct, powerful chain reaction. Step 1, providing high-quality care and managing plan performance well, leads directly to Step 2, improved patient outcomes. But it doesn't stop there. In many jurisdictions, participating in programs that link performance directly to health outcomes unlock Step 3, higher reimbursement rates and lucrative bonus payments from regulators and governments. Finally, this all culminates in Step 4, increased and protected enterprise value. By lowering costs through proactive prevention and maximizing revenue through quality bonuses, the company builds an absolutely massive competitive advantage. So the next time you're evaluating the healthcare sector or maybe looking at a managed care provider stock, ask yourself, are you just looking at the premiums they collect, or are you looking at the actual outcomes they generate? Are they truly investing in the responsiveness, the preventative care, and the patient health that will actually sustain their business for decades to come? Because as we've seen today, in the world of managed care, doing the right thing for the patient is exactly the same as doing the right thing for the investor. Thanks for joining me for this explainer, and keep looking for the real engines driving value.